When you start recording.
Okay, we're going.
All right. I'm going to interpret this 12-lead EKG using the Dubin's method. We're going to start out by finding the rate. And it appears that this QRS is on a darking line. So we're going to count starting at 300, 50, 100. We got 75, 60. So it's between 75 and 60, which I say is about 64 would be the rate. 64 beats per minute. We're going to look at the rhythm, which we got a P for every QRS. The R-to-R interval marches out. The looks like the P to P just slightly, but it marches out. Also, the PR interval is less than 0.2. The QRS looks around like 0.8, so it's less than 0.16, so there's no block noticed. So I would say this rhythm is regularly regular. We're going to check for axis deviation. We're going to look in leads 1, AVF. Both QRS complexes are upright, which suggests that it's a normal axis. Now we're going to look for hypertrophy in V1 and V5. And we're counting 5, 10, 15, 20, 25, less than 30. So it's V1, V5 is less than 35, which there is no hypertrophy. And then we're going to check for infarct. So we look in leads 2, 3, AVF, which are the inferior leads, and there's no ST elevation, T wave, there's no depression. We're going to look in the lateral leads 1, AVL, V5 and V6, which also there's no ST elevation nor T wave depression. Also, we check our septal leads V1, 2, 3, and 4, which there's no ST elevation, no T wave depression. So on this interpretation of this 12-lead EKG, it's normal sinus rhythm at a rate of 64 to 62 beats per minute, normal axis deviation, no hypertrophy, and no infarction.
All right. Here, I'll go. I got mine ready. All right. You guys can see that?
Yep.
Okay. So we'll do Dubin's method. We're going to do the rate first. And it looks like it's 300, 150, 100, 75, 60, so right at 70. Looking at the rhythm, the R-to-R intervals look like they march out. The P to P intervals look like they march out. There's a P for every QRS. There's a QRS for every P. The PR interval looks like it's right at 0.2. So it's normal. The QRS is 0.08, so it's narrow. I would say it's regularly regular. Axis deviation, looking at leads 1 and AVF, they are both upright, so there is no axis deviation. Looking at left ventricular hypertrophy, at leads V1 and V5, so it's about 5, 10, 15, 25, 30, so like 32 millimeters, so it's under 35, so there's no left ventricular hypertrophy. And now looking for ischemia or injury, we'll do the inferior wall first, so that's leads 2, 3, and AVF. And there does not seem to be any significant elevation or depression in those leads. And then looking at the lateral wall, so that's leads 1, AVL, V5, and V6. And there does not appear to be any elevation or depression in those leads. And looking at the septal and anterior walls, so V1, V2, V3, and V4. V1 and V2, there does not appear to be any elevation or depression. V3 and V4 has some T-wave inversion going on, so some ischemia of the anterior wall. So I would say this is normal sinus rhythm with a rate of 70 with no axis deviation or left ventricular hypertrophy with some with ischemia in the anterior wall.
Okay.
All right, Steph?
Yep.
On you.
Yep. Can you see it?
Yes.
Okay. So interpreting this 12-lead EKG, Dubin's method, we're going to look for a QRS on a solid line and count the rate. 350, 100. This appears to be about 75. There's a P to every QRS and a QRS to every P wave. The PR interval is less than 0.2 seconds. The QRS is narrow, 0.04 to 0.06 seconds. So there's no evidence of a bundle branch block or AV block. Next axis, looking at leads 1 and AVF. Leads 1, the QRS is upright, as is in AVF, so there's no axis deviation. Hypertrophy, I will look at V1 and V5. V5 has about 14 seconds, and V1 looks like maybe 7, so it's less than 35 millimeters. So there is no evidence of left ventricular hypertrophy. Looking for infarction in leads 2, 3, and AVF. There's no ST elevation or depression in those. V2, V3, there is also no ST elevation or depression. And then V3, V4, V5, and V6 all look to be within normal limits. So I would say that this 12-lead EKG is normal sinus rhythm with a rate of about 75. Okay.
Okay.